Hello everyone, so we are starting with the Pterygo-palatine fossa and the contents, and obviously we have to do the boundaries first. So the first thing to note is that this in red is outlined. The outlined portion is basically referring to the fossa. Now we liken the fossa to a pyramidal space because, like a pyramid, it has an apex and it has a base. How many boundaries do we need to consider? We consider an anterior boundary represented in pink in this image, and this anterior boundary is the posterior surface of the maxilla. This whole pink bone is the maxilla, and because we are concerned with this surface, which is actually not visible in this image, which is forming the anterior boundary, and therefore we say the posterior surface of the maxilla. If you just say maxilla, it is not a complete description. What about the anterior boundary? The root of the pterygoid process. What is the root? You know, the pterygoid process, it splits into two plates, the medial and the lateral, and so the part which is fused, right, that is known as the root of the pterygoid process, and that is forming the posterior boundary. Also, it can be considered the adjoining part of the anterior surface of the greater wing of the sphenoid. This part, the anterior part of the greater wing of the sphenoid, that is also the posterior boundary. Superior boundary is formed. This is the superior boundary. Again, the whole sphenoid bone is represented in yellow. That is basically the undersurface of the body of the sphenoid. Inferiorly, you can see in blue, this is the pyramidal process of the palatine bone, and this lodges in the space between the medial and the lateral pterygoid plates, which are basically the bifurcation of the root of the pterygoid, and so this is forming the inferior boundary. The medial boundary, which is closest to the midline, that is the vertical plate of the palatine bone. Now give me a second. Now in this particular image we can see the sphenoid bone, and I've represented it in this manner because it's really difficult. So what we're seeing is the lateral plate and the medial plate, and because we're viewing it posteriorly, so these are gaping wide open from a posterior view. In blue we have the body of the sphenoid, and the body of the sphenoid, its undersurface happens to be forming the superior boundary of the pterygoid fossa, so the undersurface of the body, right? And it is basically positioned in such a manner that these plates, actually not the plates, because these are plates in when we're looking at this posteriorly, and they're actually fused anteriorly. So the root of the pterygoid process is the posterior boundary, and also the adjoining part of the anterior part of the greater wing of the sphenoid. So I'm showing this to you because the sphenoid bone is a rather complicated bone. Other things to note is that this is the inferior, my apologies, this is the lesser wing, and this is the greater wing. In between the lesser wing and the greater wing, we have what is known as the superior orbital fissure. Very important thing to understand, that the superior orbital fissure is between the lesser wing of the sphenoid and the greater wing of the sphenoid. Another thing is to look at this image and kind of understand just exactly all of this is positioned, so you get the image that you're used to getting. Also note the foramen rotundum. It is important to note the position of the foramen rotundum. It will come in handy in just a while. And let's look at this image again and try to realize exactly how this is positioned, such that the body of the sphenoid, its undersurface, is forming the superior boundary, and the root of the pterygoid plate is forming the posterior boundary, and also the adjoining part of the greater wing of the sphenoid is forming part of the posterior boundary. In this image again, you can see the boundaries. We have the posterior surface of the maxilla, and this is forming the anterior boundary represented in the schematic image, right? In yellow we have the posterior boundary, and that is the root of the pterygoid process, that is basically forming it. The root of the pterygoid process is forming the posterior boundary of the fossa, and the adjoining part, because this is the greater wing of the sphenoid, and the adjoining part of the greater wing of the sphenoid is also forming the posterior boundary. We cannot see in this case the vertical plate of the palatine bone, right? But we can see the pyramidal process, and this is forming the apex, or in other words, it is forming the inferior boundary, and the superior boundary is being formed by the undersurface of the body of the sphenoid, which is not visible in this positioning. This is another interesting image because when we consider the lateral boundary, it is basically open, because laterally the Pterygo-palatine fossa leads into the infratemporal fossa, and the red is outlining the opening of the pterygo-maxillary fissure, right? What you're seeing is the infratemporal fossa, and the infratemporal fossa via the pterygo-maxillary fissure is what leads into the Sphenopalatine my apologies, is what leads into the Pterygo-palatine fossa, right? Interestingly, the Pterygo-palatine fossa then opens into via a Sphenopalatine foramen into the nasal cavity. That is something we'll consider later. Now let's take a look at this. So you can see this is the maxilla, so which is forming the anterior boundary. This is the root of the pterygoid process forming the posterior boundary, right? And you can see part of the superior boundary as well. You can see the Pterygo-palatine fossa. You can see the Sphenopalatine foramen. You can see the Foramen Rotundum. You can see the Medial canal. You can see the pterygo-maxillary fissure, which is the outline of the end point. And you can interestingly see the inferior orbital fissure as well. Now, since we've taken a look at all the various boundaries, we can now take a look at the communication, keeping the schematic of the fossa in mind, and this is a schematic representation, right? So you can see we have represented the Pterygo-palatine fossa as a pyramid, and you can see we have the apex. We have the apex of the pyramid, we have the base of the pyramid, right? We have the apex of the pyramid, we have the base of the pyramid, and we have the various sides of the pyramid. This is the pterygo-maxillary fissure, and so this is going to help in our orientation. But to make it easier, I'll still write stuff down. Because laterally, the pterygo-palatine fossa opens into the infratemporal fossa via pterygo-maxillary fissure. This is an obvious sort of communication. And medially, we know that the pterygo-palatine fossa opens into the nasal cavity via foramen known as the Sphenopalatine foramen. So this is medial. Now I'll show you an interesting image which will kind of make this easier for you to understand. This is an image in which we're seeing the medial wall of the nasal cavity over here. This is the orbital cavity, and this is the, my apologies, this is the oral cavity. So what we see over here is that this is the medial pterygoid plate of the sphenoid bone, and that forms the lateral part of the lateral wall of the, what does it do? It forms part of the lateral wall of the nasal cavity. Here we can see the palatine bone vertical plate, again forming part of the lateral wall. Here we can see part of its horizontal process, and the horizontal process is forming part of the hard palate, and its pyramidal process can be seen over here, lodging into the space or the gap between the medial and the lateral plates, right? So you can kind of understand that some of these are also the boundaries of the pterygo-palatine fossa. For example, we've said that the pyramidal process is the inferior boundary, and we've seen the root of the pterygoid plate, which is opposite this before the splitting, is the posterior boundary, and we've talked about the maxilla being the anterior boundary, right? And stuff like that, right? So this is why I'm showing all of this to you, because the Sphenopalatine foramen, you'll be able to understand how the Sphenopalatine foramen, which is located on the medial wall, which is located over here in the perpendicular plate of the palatine bone, how it basically leads into the nasal cavity. From where? From the pterygo-palatine fossa. For example, over here you can clearly see the Sphenopalatine foramen being represented, this one over here, and the outline of the pterygo-maxillary fissure is also seen. This is again a schematic representation, but now we have represented it as a cuboid and not as a pyramid. And you can see this is the medial communication with the infratemporal fossa. This is the lateral communication with the nasal cavity, right? And I'm hoping this makes it easier for you to understand and grasp these points. Again, you can see the pterygo-palatine fossa being represented, the representation of the fissure, and the representation of the foramen, which is in the medial wall of the cavity. My apologies, the medial wall of the fossa. In this one, again, this is more interesting because again we are taking a look at the medial wall of the nasal cavity, and we can see this is the medial pterygoid plate, and this over here is the perpendicular plate of the palatine bone, which forms the medial wall, and this is the Sphenopalatine foramen seen over here. This is then the, if you compare these two images, you can see the Sphenopalatine foramen easily, right? It's between the sphenoid bone and the palate bone. Now we're taking a look at this schematic again. Now the reason I'm using so many different images is because images I feel are one of the best ways in which you can kind of understand something. So we have a medial communication understood, we have the lateral communication understood. What about the communication with the oral cavity via these foramen? Now these foramen are present, if you remember, in the pyramidal processes of the, as you can see, the pyramidal process is the inferior boundary of the pterygo-palatine fossa, and it lodges into the gap between the medial and the lateral pterygoid plate. and it is the pyramidal process and the area near to it which bears the lesser palatine foramen. The greater palatine foramen is actually not in the pyramidal process, but the greater palatine foramen is on the horizontal plate of the palatine bone. So I'm hoping you kind of understood this one. Over here you can see the skull, and in this luminous screen we have the representation of the various parts of the palatine bone. This shown over here is the vertical, this is the vertical plate of the palatine bone, and the vertical plate happens to have various processes, mainly orbital and sphenoidal processes. It also has this part, the horizontal plate forming part of the hard palate, and this pyramidal process over here. So part of the horizontal plate of the palatine bone bears the greater palatine foramen, and the pyramidal process bears the lesser palatine foramen. And you know the hard palate is kind of like in between the oral cavity and the nasal cavity. So the communication does make sense, especially with the lesser palatine foramen, how the Pterygo-palatine fossa is able to communicate with the oral cavity. Now this is an anterior communication with the orbit via the inferior orbital fissure. Now if you know the inferior orbital fissure is between the maxilla and the sphenoid, we're considering the boundaries at the moment, right? And so via the inferior orbital fissure, the Pterygo-palatine fossa does have communication with the orbit, and posteriorly there is a communication with the middle cranial fossa, and the middle cranial fossa is one of the three fossa in which the cranial vault is divided. We have the foramen rotundum, which is located in one of the borders of the greater wing of the sphenoid. Right, so I'm hoping this is clarified now. In this image I will show to you again, this is us looking at the hard palate from below, and this is the horizontal plate of the sphenoid, and the horizontal plate of the sphenoid is bearing the greater palatine foramen. This over here below it is the pyramidal process, which is in between the medial and the lateral pterygoid plates, and the pyramidal process is bearing the lesser palatine foramina. Again, in this image I want you to take a look at where the foramen rotundum is located. Now let's see again, this is the sphenoid bone, and in blue we have the body of the sphenoid, and we are looking at it from behind, and we know that the undersurface of this is going to form the superior boundary of the Pterygo-palatine fossa, and we know that this part, which is the root of the pterygoid process, is going to form the posterior boundary, and also we know that the greater wing of the sphenoid is not going to form a boundary per se, but the foramen rotundum is the communication, right, between the middle cranial cavity and the Pterygo-palatine fossa, because in addition to the root of the pterygoid process, the adjacent parts of the greater wing of the sphenoid, they also form the posterior boundary. So I'm hoping this makes more sense now, because over here we have the root of the pterygoid plate, and this is the adjoining part of the greater wing, and so the foramen rotundum is a communication in the posterior boundary of the pterygoid fossa, by which the pterygoid fossa is able to communicate with the middle cranial cavity. In this image again we can see this is the roof, and that is formed, we can say it is formed primarily by the body of the sphenoid, right? This is the anterior, and anteriorly we have the posterior surface of the maxilla, and we know that within the maxilla there is something known as the maxillary sinus, and we know the inferior orbital fissure is between the maxilla and the sphenoid. So it's somewhere over here, and we can sometimes consider it as being anterior and sometimes in the roof, so it's more of an anterosuperior location, to be honest. Posteriorly we have the pterygoid plates, right, and we also have the foramen rotundum. Laterally we have the communication, we have the pterygomaxillary fissure, and medially we have the vertical plate of the palatine bone bearing the Sphenopalatine foramen. Contents, interestingly, the most important one is something known as the Pterygo-palatine ganglia, and we also have something known as the descending palatine artery, which is actually going to divide into the greater and the lesser palatine arteries. We also have the maxillary division of the trigeminal nerve. We're going to have the nerve of the Pterygoid Canal, which is going to be formed by the deeper and the greater petrosal, and we will have the Medial nerve, which is the nerve of the Pterygoid Canal, and we will also have the Median artery. In this flowchart, we can see this is the infratemporal fossa, and it is leading into the Pterygo-palatine fossa via the pterygomaxillary fissure, and this is leading via the Sphenopalatine foramen into the nasal cavity. So we can see the communication over here. Again, let's look at this image, and unfortunately it's a bit blurry, but it is still good enough. We can see the greater palatine canal. We can see the pterygomaxillary fissure in red. We can see the Sphenopalatine foramen in the medial wall. We can see the foramen rotundum, and we can see the Pterygoid canal or the Pterygoid foramen again in the posterior wall, and we can also see the fossa. Now if we consider the various contents, so when we did the maxillary artery, we considered that the third part of the maxillary artery happened to be in the Pterygo-palatine fossa, and also the branches of the third part. save a few. And they bear the same names as the branches of the Pterygo-palatine ganglia, which is another content of the fossa, and will accompany. So the nerves and the arteries will accompany each other. Over here, for example, we can see the maxillary artery. My apologies. This is the maxillary artery over here. Right, actually this is the external carotid, and here the maxillary starts. This is the blue part, the green part, and then we have the yellow part. The yellow part is the part of the artery, the third part of the artery, which is in the Pterygo-palatine fossa, and so that is a content of it. So that is something you need to consider. Then we consider over here, let's see which are the branches of it, the branches of the third part. The first one is the descending palatine artery, which is a branch which we need to consider, which divides into two branches, the greater palatine artery and the lesser palatine artery. The greater palatine artery supplies the hard palate, and the lesser supplies the soft palate, the palatine tonsil and the pharyngeal wall. And let's look at this one over here. This is labeled as the ninth. So what you're seeing over here, this is the representation of the descending palatine artery, which is a branch of the maxillary artery which divides into greater and lesser palatine arteries. Then we have another branch, the posterior superior alveolar artery, which is the 10th one. The posterior superior alveolar artery is this one over here, which is a rather interesting one. And it is the one that is going to be supplying the maxillary molars, which are the teeth, the maxillary sinus, the sinus in the bone, and the gums. Another important thing to understand is the infraorbital artery, which is basically the continuation of the maxillary artery which enters into the orbital cavity via the infraorbital fissure. Then we need to consider the artery of the Pterygoid Canal. We need to consider the artery of the Pterygoid Canal, which is represented over here, and we need to consider the Sphenopalatine artery, and it's like the Sphenopalatine Foramen. Obviously it's going to head into the nasal cavity. So how many branches have we considered of the third part of the my apologies, the maxillary artery? We have considered the descending palatine artery, represented as 9, which divides into the greater and the lesser, and you can see the division. Greater palatine artery, lesser palatine artery. Greater palatine artery is supposed to be supplying the hard palate, and the lesser palatine artery is supposed to be supplying the soft palate. And these are interesting things that you do need to understand, because the greater palatine artery is going to be supplying the hard palate, and the lesser palatine artery is going to be supplying the soft palate. And we can see the posterior superior alveolar artery, the infraorbital artery, which is the main continuation of the maxillary artery, heads into the orbit, the artery of the Terragoid Canal in the posterior boundary, and you can see the Sphenopalatine artery represented as 13. This is the Sphenopalatine artery, which basically heads into the nasal cavity directly. We will consider the details. It's not something you should get overly confused about. Now let's talk about the maxillary nerve. Now we know the maxillary nerve, it arises from the trigeminal ganglia, right? We do know that it is arising from the trigeminal ganglia. That it pulses in the lateral wall of the cavernous sinus below the ophthalmic nerve, which is again a division of the trigeminal ganglia. Now, important thing, it leaves the middle cranial fossa by passing through the foramen rotundum, and we have already considered that the foramen rotundum is located in the posterior boundary of it. And you can see this is the trigeminal ganglia, this is the ophthalmic nerve, and this is the maxillary division. First of all, in the lateral cavernous sinus, where the ophthalmic division is above it. Then it enters into the foramen rotundum, but passes into the foramen rotundum, and then through it into the Pterygo-palatine fossa. Now you need to consider the fact that the nerve will cross the upper part of the fossa. As you can see, this is the upper part of the fossa, beyond which it is continued as the infraorbital nerve. So maxillary artery continues as the infraorbital artery, and the maxillary nerve continues as the infraorbital nerve. This over here is the maxillary division, and over here you can see that there has been a name change to the infraorbital nerve. In the middle cranial fossa, the maxillary nerve gives a meningeal branch. So while it is still in the middle cranial fossa, the maxillary division gives a branch known as the meningeal branch of the maxillary division. Now in the Pterygo-palatine fossa, the nerve is related to the Pterygo-palatine ganglia. You can see this is over here, and you can see the Pterygo-palatine ganglia over here, and there is an anatomical relation. And it gives off how many branches? Number 1, the ganglionic branches, and these are the ones that will interact with the Pterygo-palatine ganglia. We will have the posterior superior alveolar artery, like the posterior superior alveolar nerve, and we will have the zygomatic nerves. You need to be considering all of this, right? Now let me again show the various nerves. So you can see again we're having a view of it. See the representation of the Pterygo-palatine ganglia. See, this is the representation of the maxillary nerve, and the maxillary nerve is entering via the foramen rotundum that is located in the posterior boundary of the Pterygo-palatine fossa. It is then renamed as the infraorbital nerve, which enters via the inferior orbital fissure into the orbit. You can see its ganglionic branches. This is one ganglionic branch, this is a second ganglionic branch interacting with the Pterygo-palatine fossa. Right, you need to see the representation of the fissure. You need to see that it has other branches. For example, this is the main maxillary nerve. It has a branch known as the posterior superior alveolar nerve. Right, so posterior superior alveolar nerve. I'll show you the zygomatic nerve in another image. In this image, see, this is the trigeminal ganglia. This is its maxillary division. The ganglia is itself in the middle cranial fossa. Maxillary division enters via the foramen rotundum in the posterior wall of the Pterygo-palatine fossa into the fossa itself, and there it gives the ganglionic branches which are interacting with the Pterygo-palatine fossa, and from here we can see the greater and the lesser palatine nerves being given off, and you can see the branch, very important branch, both of which enter into the inferior orbital fissure. We have a branch known as the zygomatic nerve, and we have the main continuation known as the infraorbital nerve. So this is a branch of it, the maxillary division, but the main continuation is this one known as the infraorbital nerve. And we can see the zygomatic nerve then basically divides into zygomatico-temporal nerve and zygomatico-facial, which you would have already encountered in the face. Zygomatico-temporal and zygomatico-facial foramen. This one over here is the infraorbital nerve with its anterior, posterior and middle superior alveolar nerves. We've already considered this particular branch, although it is better to now understand that it is in fact a branch of the infraorbital nerve. We've talked about the posterior superior alveolar nerve being the content of the fossa as well, and you can then see it entering via the infraorbital foramen. Then it is no longer in the orbit, rather it is in the face. Now let's talk about. Now this is an interesting description. We can see the maxillary artery, and you know how it enters into the pterygomaxillary. This is the representation of the Pterygo-palatine fossa. It enters via a fissure known as the pterygomaxillary fissure. This is then therefore the third part of the artery. It gives the various branches, the posterior superior alveolar artery that exits, right? It gives an artery to the Pterygoid Canal. It gives, my apologies, the infraorbital artery which enters into the orbit anteriorly, because the orbit is anterior, right? And it's basically the roof and the anterior wall. In between we have the fissure, the infraorbital fissure. The maxillary artery branch, Sphenopalatine artery, enters into the nasal cavity, and the Sphenopalatine foramen is located in the medial wall, right? Now the maxillary artery gives this interesting branch known as the descending palatine artery, which enters inferiorly via the greater and the lesser palatine foramen, not actually both of them, rather just the greater palatine foramen, which leads into the greater palatine canal, and that is how the descending palatine artery enters into the oral cavity. This one is considerably interesting. You can see the trigeminal ganglia in the middle cranial fossa. You can see its various divisions. This is the maxillary nerve, enters into the fossa, Pterygo-palatine fossa via the foramen rotundum, has ganglionic branches that interact with the Pterygo-palatine ganglia, has its main continuation, has its branch, the zygomatic nerve, which enters into the orbit, has its branch, the infraorbital nerve, also enter and also subsequently exit, has its branch, nasopalatine nerve, and this nasopalatine nerve basically enters into the nasal cavity, also has its greater and lesser palatine nerves which enter into the oral cavity. Now let's take a look at some of the details. The ganglionic branches. The Pterygo-palatine ganglia is suspended by the ganglionic branches. This is the Pterygo-palatine ganglia, and you can see it is suspended by the ganglionic branches of the maxillary nerve. Then we have the posterior superior alveolar nerve. It is represented like this, right? And it enters the posterior surface of the body of the maxilla. The maxilla is located anteriorly, and it supplies the 3 upper molar teeth and the adjoining part of the gum. the 3 upper molar teeth and the adjoining part of the gum. You can see the maxillary sinus over here, and therefore the anterior location is confirmed. This is then the zygomatic nerve, and now look at the inferior orbital fissure being represented between the anterior and the superior. It is a branch of the maxillary nerve given off in the fossa, the Pterygo-palatine fossa. You can see in between these two we have the fossa. It enters the orbit through the lateral end of the inferior orbital fissure. The inferior orbital fissure has a lateral end and runs along the lateral wall outside the periosteum to enter the zygomatic bone. Just before or after entering the bone, it divides into 2 terminal branches, the zygomatico-facial and the zygomatico-temporal, which supply the skin of the face and of the anterior part of the temple. The communicating branch to the lacrimal nerve, which contains secretomotor fibers to the lacrimal gland, arises from the zygomatico-temporal nerve and runs in the lateral wall of the orbit. So we also have a communicating branch going to the lacrimal nerve, and this is coming off of the zygomatico-temporal nerve. We also have the infraorbital nerve. As you can see, this is the infraorbital nerve. This is the zygomatic. The zygomatico-temporal, the zygomatico-facial enters into the face, supplies the face and the anterior part of the temple. From the zygomatico-temporal, we have coming off the communicating branch to the lacrimal nerve. Now let's concentrate on the infraorbital nerve, which is the main continuation of the maxillary nerve. It enters the orbit through the inferior orbital fissure. As you can see, both of them are entering via the inferior orbital fissure. It then runs forwards on the floor of the orbit or the roof of the maxillary sinus, at first in the infraorbital groove and then in the infraorbital canal, remaining outside the periosteum of the orbit. It emerges on the face through the infraorbital foramen and terminates by dividing into palpebral, nasal and labial branches. Palpebral to the palpebra, nasal to the nose, and superior labial. The labial has to do with the lips. Palpebral feature, as you can see, has to do with the eyelids. Now the nerve is accompanied by the infraorbital branch of the third part of the maxillary artery and the accompanying vein. So you need to understand at least the names: palpebral branch, the nasal branch, and the superior labial branch. Palpebral branch, and this is actually on the floor of the orbit in a groove, which is basically a depression, and then a canal which is completely enclosed, and then it exits the orbit via foramen known as the infraorbital foramen in the margin of the orbital cavity. In this particular image, you can see the infraorbital foramen, you can see the infraorbital canal too, and you can see the maxillary sinus below it. So we can say it is on the floor of the orbit or on the maxillary sinus because it is just below it. So we've talked about the main things. The rest of it we will do in the next part video.